Arthritis is mainly due to wear and tear of the joints, the bone ends rubbing together. Some kinds of arthritis are due to inflammation in and around the joint. Rheumatoid arthritis is a typical example of this, but there's also ankylosing spondylitis, which is a kind of inflammatory arthritis. Then there are chemical kinds of arthritis like gout, which is due to crystals inside the joint space. Of all the kinds of arthritis you can get, and there are about 200, the most common is osteoarthritis or osteoarthrosis. This is a model of a knee joint. It's a model of a right knee joint, and these bits here are cartilage. What happens in osteoarthritis is that these get worn away, so that instead of having this lovely cartilage which normally cushions the joint, they wear away and you get bone rubbing along bone every time that you'd use a knee joint. You can get osteoarthritis in almost every joint in the body. A lot of people, especially women, get it in the small joints in their hands, but you can also get it in the knees, in the hips, in any other joint, and it doesn't have to be symmetrical. You can get it, for instance, in one hip rather than the other. The other hip can be absolutely fine.
Symptoms primarily, as far as the layman is concerned, would always start with the pain, the painful joint. Pain is something which is easiest to be detected by a layman, by a human mind, because pain is a very important and hurting sensation. But there may be other symptoms, like there may be swelling which may be visible to a layman. There may be a feeling there's a fluid in the joint. And if the inflammation, the grade of inflammation is high, then there would be other symptoms like raised temperature and change of color, like redness around the joint. So these are the common symptoms, and again, according to the cause, it may vary.
Obesity, injuries, even genetics, all can put you at risk for developing arthritis.
Well, it's a disease of the joints and bones. We do not understand very well what's driving this process, but it's more commonly seen in elderly population and people above age of 40.
While arthritis can happen in any joint in the body, doctors say there are certain joints that are more affected than others.
The ones we use the most, hands for example, feet, and the weight-bearing joints, back, hips, knees, and ankles.
You can do to ease and often prevent discomfort. Firstly, exercise. It might seem strange to suggest movement when you're feeling sore, but during gentle exercise, your body releases substances that lower inflammation. Exercise also strengthens the structures around joints, which helps to relieve any pressure on them. Secondly, watch what you eat. Your body sees high carbohydrate and processed foods as foreign and responds by releasing substances that increase inflammation. By swapping out processed foods for fresh, whole food, your whole body benefits, not just your joints.
The main reasons to treat arthritis is if you're having pain or functional limitations. The treatments for arthritis include conservative measures such as physical therapy, injections, anti-inflammatory medications, and then if none of those are working, you can also do surgery, which would involve a joint replacement of the arthritic joint.
I have arthritis. How can I exercise? It hurts. I feel worse the next day. How could this be good for you? But the key role is that exercise, you got to keep your joints moving if you want to keep them healthy.
Dr. Husney says exercise reduces joint pain and stiffness and builds muscles around the joints. She says flexibility, strength, and aerobic exercises are all good choices. Water-based therapy works well too. You're buoyant, which makes it a little easier to move, but the resistance of the water helps to build strength. Dr. Husney says it's important not to try to do too much too soon and to find an exercise program that works for you.
If you're really, feeling it the next day, pain all over is getting a lot worse, then you want to just set yourself, modify it back a little bit. So instead of exercising every other day, we might want to go down to once a week until that body part heals.
Dr. Husney says to consult your physician before beginning any exercise program.
And from here, straighten the front knee. And we're going to come into triangle. So you do have the block handy if you want to use the block for your triangle pose. Some of you have a wall right there that you can use. Reaching out, lower the right hand down as far as feels comfortable for you. It can be to the shin or to the block or to the floor. And you can take the upper hand to the hip. If you'd like to extend that arm up overhead or something akin to that, if that's available to you, that's fine too. And again, find the positioning of the head that feels good for you. So you can gaze up toward the ceiling, straight ahead, or even down toward the floor if that feels better for your neck. Make sure that you're breathing. Notice if your front knee is locked.